Mr. President, allow me to thank you. As a grandmother, left with huge responsibility of raising my grandchildren, the social cash transfer that you have been giving us goes a long way in helping us our needs. At least I can afford to buy my beautiful grandchildren school supplies. We thank your poor government for supporting more vulnerable citizens like me. I pray that you continue helping those in need as our president for the next 5 years.
Good evening, our roundtable viewers from across the globe, and welcome to this episode of the roundtable discussion dubbed Zambia Decides Edition. On this edition, we are featuring the Patriotic Front Party functionaries such as the former cabinet ministers and members of the Central Committee to discussions of national interest. This evening, we are privileged to host the immediate past Minister of Health of the Republic of Zambia, and this is none other than Dr. Jonas Chanda. Now, Dr. Jonas Chanda is also the PF candidate for the Bwanamkubwa constituency seat on the Copper Belt. Dr. Chanda, you are welcome to the roundtable discussion.
Thank you so much, and greetings to the listeners and the viewers out there.
Great stuff. Thank you so much. Now, Dr. Chanda, could you just maybe tell us how the campaigns are going in Bwanamkubwa constituency?
I'm just from the campaigns right now. So I was in the middle of the campaigns with 4 or 5 days to go before the elections. The campaigns are going on well. In Bwanamkubwa constituency, we have 8 wards: Mushili, Lupili, Tuashuka, Chichere, Kantolomba, Munkulungu, and Kav. All the 8 wards. We expect that the PF government, His Excellency President Edgar Chagwalungu, will get a massive vote. The PF, as a party, will get a maximum vote in Bwanamkubwa constituency. As you know, Bwanamkubwa has 56,650 registered voters.
Chambo chanoa baba muwato wanoa nokubamba na tubomba sofa tatwakaleke sori muchambo chanoa baba muwato wanoa nokubamba na tubomba sofa tatwakaleke sori.
Good evening, our roundtable viewers from across the globe, and welcome to this episode of the roundtable discussion dubbed Zambia Decides Edition. On this edition, we are featuring the Patriotic Front Party functionaries such as the former cabinet ministers and members of the Central Committee to discussions of national interest. This evening, we are privileged to host the immediate past Minister of Health of the Republic of Zambia, and this is none other than Dr. Jonas Chanda. Now, Dr. Jonas Chanda is also the PF candidate for the Bwanamkubwa constituency seat on the Copper Belt. Dr. Chanda, you are welcome to the roundtable discussion.
Thank you so much, and greetings to the listeners and the viewers out there.
Great stuff. Thank you so much. Now, Dr. Chanda, could you just maybe tell us how the campaigns are going in Bwanamkubwa constituency?
I'm just from the campaigns right now. So I was in the middle of the campaigns with 4 or 5 days to go before the elections. The campaigns are going on well. In Bwanamkubwa constituency, we have 8 wards: Mushili, Lupili, Tuashuka, Chichere, Kantolomba, Munkulungu, and Kav. All the 8 wards. We expect that the PF government, His Excellency President Edgar Chagwalungu, will get a massive vote. The PF, as a party, will get a maximum vote in Bwanamkubwa constituency. As you know, Bwanamkubwa has 56,650 registered voters, and we're not leaving anything to chance. So we'll make sure that PF wins with a huge landslide constituents next week, based on our development agenda in various.
Great stuff, Dr. Chanda. Now, Dr. Chanda, you are the immediate past Minister of Health of the Republic of Zambia. And, you know, we know that the PF government has invested heavily in, you know, health in this nation. The president has placed a lot of premium on health. Why did the PF government invest so much in the health sector?
Yeah, no, thanks so much. I think that's a very important question. We should all understand, you know, when PF took over power in 2011, we defined health, not basically in terms of sick care, you know, whether you are sick or not. I think we look at health in a much broader sense in the PF when we look at our manifesto. So the way we look at health is that it's also an economic issue. There is no sustainable socio-economic development minus health. That is why we say when people are healthy, they are going to be more productive and the country will be much more wealthy. A healthy nation is a wealthy nation. So that is the premise on which the PF started implementing, you know, the serious reforms in the health sector, is to link it to socio-economic development. And in 2011, the PF government inherited a lot of gaps. And I can give you an example of the huge gaps that we inherited as a government in 2011. Infrastructure development. You know, since the UNIP days, we had started, you know, standard infrastructure. We remember when His Excellency President Kenneth Kaunda ruled Zambia for 27 years. Where I mean in Dollar, the only hospitals that we had were Dollar Teaching Hospital and the Davison Hospital. And up to 2011, those were the only hospitals. And the same is true of many towns in Zambia, whether you're in Lusaka, University Teaching Hospitals, the only hospital, apart from the Levy Hospital, which was a small hospital. So PF inherited huge infrastructural gaps in terms of infrastructure, starting from the health posts, primary health centers, you know, coming to the district hospitals, the one hospital, the specialist hospitals, the teaching hospitals. When we took over, there was only one teaching hospital in Zambia, the University Teaching Hospital. Today you can talk about Ndola Teaching, you know, Kito Teaching Hospital, and a lot of such. So basically that is, so apart from the infrastructure gaps, you look at the human resources, what we call health worker patient ratio. When PF came to power, that means there was a serious shortage of health workers. And I speak as a former national president of the Resident Doctors Association of Zambia. I was already as a national president when MMD was in power, 1999 to 2001. We had serious challenges. We had places, doctors were a luxury. You could only find them at a bigger hospital. So we had huge challenges in terms of human resources for health, for doctors, for nurses, specialist nurses, the pharmacists, the laboratory technicians, and all others are specialized, you know, health workers. We had serious challenges in terms of equipment. The best equipment was no scan, you can't do a CT scan, you can't do an MRI. So PF inherited huge challenges again, gaps in terms of specialized equipment. Also in terms of the drug supply, you know, only had one medical stores hub in the country, in Lusaka, in the industrial area. That was the only one. So from there, the drugs were delivered directly to the health facilities. So that's the issues that PF inherited. But of course, we also inherited a huge disease burden in 2011. You talk about infectious diseases like TB, HIV, malaria, huge challenges that we inherited. You talk about non-communicable diseases, hypertension, diabetes, the cancers. You talk about maternal and child health. So that's a huge challenge. That is why His Excellency President Edgar Chagwa, and before him, the late President Michael Chilufya, may so rest in peace, prioritized health as a socio-economic development. Because without these challenges, when people can't access basic healthcare services, we will not be a healthy nation, we will not be a wealthy nation. So basically that is our premise. And our goal in PF, when you look at the National Health Strategic Plan, when you look at the PF manifesto, is to achieve universal health coverage without leaving anyone behind. PF is a pro-poor party. It's not an elitist party where, you know, only the rich can access healthcare services. So the aim of PF in all what I've talked about is how to ensure that we have universal health coverage. Every citizen, all the 18 million Zambians have healthcare, access to healthcare services without leaving anyone behind. So basically that has been the premise, and that has been our push in terms of what I'll talk about at every level, whether you're at the village level, the small towns, the companies, the bigger towns, the cities, everyone is scattered. I think that is basically the direction that we've taken.
Great stuff, Honorable Chanda. Now, you know, you've mentioned that there was a lot of infrastructure for health that the PF has, you know, built. Are you able to tell us, you know, to the extent that there has been infrastructure of health, could you perhaps outline which health facilities the Patriotic Front, you know, constructed in the period that they have been in government?
Yeah. In fact, if I was to start itemizing them, we would spend hours because there are so many. But I will make it very simple. So I'll start with the district hospitals. Within 9 years, PF government has 36 district hospitals. As you know, part of our national decentralization policy was to create more districts. It started, I think, immediately that we took over power in 2011. Once you create a district, that district has to come with district level facilities, whether it's in terms of health services, the police services, the schools. Right? So in terms of health, PF has had to create 36 district hospitals in line with the national decentralization policy. Once you create a district, give it a district level hospital. But not only in the new districts, even in existing cities, we've had to create district hospitals. So these 36 have been done in a very short period, in 9 years. Compare that to what MMD did in 20 years. I don't know how many district hospitals MMD built, but if I'm not mistaken, there cannot be more than 5 in 20 years. For us in 9 hospitals, we built more than 36 district hospitals at the minimum. Up district hospitals, we have also, we have a program, called this mini hospital program, where we are constructing 108 mini hospitals across the country. Out of the 108, as we talk, almost 50 are complete and commissioned. We've seen a lot of them commissioned. They're in Central Province, in Lusaka, in Luapula, and other areas. This is an example of leaving no one behind. Because, before PF came to power, people would only access a hospital at a provincial capital, even in the other towns that we have in Zambia. But for the first time today, you can go to a very rural place and you find a mini hospital. A mini hospital, like we are saying, it's lower than a district hospital, but it has all the essential services. It has the wards, adult wards, male, female, the children's wards, basic services, x-rays, all those, even minor theater, surgeries can be done at a mini hospital. So, and the pharmacies, dispensaries, so 108 mini hospitals. It's no mean achievement. So we've done 50 which are commissioned, others are ongoing. Where I am on the Copper Belt alone has received about 15 mini hospitals in addition to the existing health infrastructure. You go to Luapula, probably they got about 20 something. Northern Province, Eastern Province, Southern Province, Western Province. Everyone has, that. Apart from that, again, as the PF government, we looked at the rural areas. The majority of Zambia is actually rural. Zambia is mostly rural. There are very few urbanized areas. And people were left behind. That is why government, through the Ministry of Health, led by His Excellency the President Dr. had to prioritize the rural health post program, 650 rural health posts. As we talk, out of the 650 health posts, we have 563 already done. That is probably over 90% was done. My constituency, Bwanamkubwa, is a huge recipient of the health posts themselves. You go to places like Tagaga, you go to Chichele. These are far-flung areas. To access health services, people have to travel maybe 1 hour, 2 hours just to get to a nearest health facility. Today, they have these rural health posts well spread across the country. All the 10 provinces have benefited from the 6 projects. We have 7 general specialists, because in Zambia, again, like I was saying, when I was a student trained at UTH campus, we only had 1 specialist hospital. That was the university teaching hospital. UTH was working clinic, it can also work as a specialist hospital. But what the PF government has done is to create 7 super specialist hospitals. So apart from the teaching hospitals that I mentioned, like the UTH itself, UTH is actually, because there are about 5 hospitals within UTH. Ndola became a teaching hospital, from Ndola Central to Ndola Teaching Hospital. Kitwe, my former workplace, became a teaching hospital, from Kitwe Central to Kitwe Teaching. Accompanied Medical University, the CBU School of Medicine is linked both in Ndola and Kitwe. Then you look at UTH itself, so the special resources that we've created, just to mention for those who may not, include the Kalindawaro in Petauke. When you're in Petauke, you see a very beautiful hospital. That is the Kalindawalo. It's a specialist hospital created by the PF. You go to Chinsali, you see the specialist hospital. In Lusaka, when you are going by the airport, you have the Lusaka Specialist Hospital, which is actually planned to be a heart hospital, the first ever heart hospital in Zambia. So we have that. We have the King Salman Abdulaziz Hospital, which is being constructed in Chalala as a specialist mother and child hospital. So all these specialists, the Bangolu Hospital is under construction in Northern Province. It's going on. So you can see that we have addressed this infrastructural gap at every level, starting from the rural health system, coming up to the level 1 hospitals. I should also mention that we have transformed 15, primary health centers into level 1 hospitals. And a very good example where you see this massive transformation is Lusaka. You go to Matero, you have that level 1 referral hospital. You go to Chipata compound, you go to Chawama, you go to Kanyama. And we're doing the same in other areas, the Copper Belt, like in Indola, in Mushiri Township, where I am right now, and in Chamboli, in Kitu, we're doing the same. So, I mean, in terms of infrastructure development, UNIP wrote for 20 years, MMD for 20 years, 47 years. When you compare the two governments in terms of the 47 years that they wrote, you can't compare with what PF has done just in under 10 years. We've achieved all this in under 10 years. That's what people forget. So we've achieved a lot. And like I was saying, look, to match health infrastructure or health services, you have to match it with population growth. When our friends, MMD and UNIP were in power, of course, the population was smaller. Now we're dealing with a bigger population, 18 million plus. But we've done well to close the gaps. And so I'm very happy with what His Excellency the President, Dr. Edgar Chagwa has laid the PF government on. And that is the way to go. Because for the first time since independence, the chiefs in Zambia can go now demanding for a mini hospital, bring a hospital in my chiefdom. I personally have talked as former Minister of Health to a number of our traditional leaders who are very happy to have mini hospitals right in their chiefdoms, which was unheard of just in a few years ago. So we're very, very proud of the achievements of the PF government. And I think we're very confident that Zambians will vote us based on this, record that we have, because they're accessing real, tangible health services through this infrastructure.
What about the issue of maternal mortality, Dr. Chanda? We know that the president has been very passionate about seeing, issues of especially women not dying whilst giving life, and, the numbers of children that die when, during childbirth. How has the PF government fared, and how are the numbers now compared to in the past when a lot of, we had a lot of maternal deaths?
When I was a medical student, the maternal mortality rate for Zambia was very high, close to 500 probably per 100,000. It was very, very high. When His Excellency President Edgar Chagwa declared a public health emergency on the maternal mortality rate, for example, we had maternal mortality of 328 per 100,000. Today, as we talk, we have had to work hard. They will reduce that actually to 272. So from 378 per 100,000 to 272 per 100,000. It's a huge achievement, but yes, we acknowledge there's still a lot that needs to be done. That is why the president declared it an emergency. But this is the lowest that it has been. There's no magic to reducing the maternal mortality rate. It's making sure that our women, expecting mothers, have access to antenatal services, the labor, delivery services when they are pregnant. And that is why we have been making sure that not only are we building the health infrastructure like, the rural health posts, the primary health centers, level 1 hospitals, district hospitals, but we're also matching that with human resources health. The PF government embarked on a very ambitious agenda of recruiting 30,000 health workers just a few years ago. Today, as we talk, as of July this year, July 2021, we have achieved quite a lot, 27,000 plus out of the 30,000 targets. We are seeing the maternal mortality rate dropping down. There's a lot that needs to be done. But I should mention that when the maternal mortality rate was high, we used to lose up to about 30 women per week dying in pregnancy. During labor, they would die 30 per week. Today, we are losing about 12 per week. So we've cut that into more than half. But that is not enough. What we want is to aid maternal mortality, totally. And we are on the right path, because if you can reduce maternal mortality rates from 378 to 272 per 100,000, You can reduce women dying in child birth when they're giving birth from 30 per week to about 12 per week as we talk. That is a huge achievement, but we can still do more. And that is why we have been talking about universal health coverage. How do we ensure that no woman is dying? Every pregnant woman in Zambia should have access to antenatal services. They should have access to a qualified midwife who gives skilled health workers who assist them during delivery. And if there are complications, there should be a nearby health facility where you can do complex procedures like a cesarean section. Instead of in the past when people used to deliver in their houses, they used to die in their houses. So that is the agenda that PF has, and we are right. We're on the right track. I think we can see the progress is all there to see.
Now, Dr. Chanda, is it true that for the extreme health infrastructure that the PF has, been able to deliver to the Zambian people, we can even go as far as saying is that the PF government is infrastructure, health infrastructure centric, because there has been really so many health facilities built. But do these health facilities have medicines? I ask this because there is, talk from different sections of society that despite the PF, constructing all these medical facilities, some people are saying, some sections of the opposition especially are saying that there is no medicines in these hospitals.
Yeah, I don't know what they mean by saying there's no medicine. Because again, when you look at a system, it's a system. They're not just talking about one item. So health infrastructure is one part of the health system. Human resources for health, right? The people that we've recruited is one part. The medical supplies of medical, the drugs and other essential medicines and other medical supplies is one component. And that is why I was saying one of the major things that the PF government has done, which was not done by previous governments, is to decentralize the former Medical Stores Limited to what we are calling the ZAMSA, Zambia Medicines and Medical Supplies Agency. When you look at ZAMSA, the way it has been decentralized, we have gone to what we call regional hub. So apart from that huge former Medical Stores Limited in Lusaka, the ZAMSA in Lusaka, we have provincial hubs. Right here on the Copper Belt, we have a provincial hub in northern, in eastern, in all these places. The whole idea is that when you decentralize, drugs and other medical supplies to a provincial level, it will be easy for that provincial hub to supply the district hospitals, the provincial hospitals, the other smaller health facilities, rather than that over-centralized system that we had in the past. So in terms, it's not true to say there are no drugs in the hospitals, because those opposition, I challenge them to go to any clinic. They'll find medicine, right? They'll find the essential, what we call essential medicine. The painkillers are there, the antibiotics are there, the antimalarials are there. Yes, we may have a challenge, like with some of the, these expensive drugs, highly specialized drugs that have to be imported from the country. They come at a huge cost, like the anti-cancer drugs, for example. Yeah, so those drugs, we may have a challenge been a lot to the cancer disease hospital in Lusaka, been to ZAMSA, to procure those drugs and to deliver them at the cancer disease hospital. As sometimes dramatic, but the good news is that those challenges are being addressed, So we are not saying everything has been done perfectly, but we are the first government. The PF government is the first one to decentralize the supply chain management system for medicines and medical supplies in Zambia, not only at a national level, like the central level in Lusaka, but at a regional level. So when you're on the Copper Belt, for example, you don't have to wait for that ZAMSA hub in the industrial area in Lusaka to supply Ndola teaching or Kitwe teaching. There is one just after the toll gate in Ndola, as you go to Rwansha and Kitwe. We have a ZAMSA hub there, which is able to supply at a provincial level. And the same is true of all the other, provinces that we are talking about. So drugs are there, but what we are saying is that it's one thing, when you talk about improving the healthcare system, there's quantitative expansion, which is what we're talking about, the infrastructure, the human resources for health, the equipment. That is the quantitative expansion. There's also the qualitative expansion in terms of making sure every bit is in there. We have moved a long way from having hospitals only having an X-ray to having the hospitals today having an MRI, magnetic resonance, having CT scans, very specialized equipment, doing very complex surgeries that we never used to do. Look at UTH, we've got to separate conjoined twins. When we used to refer those cases to South Africa, There are very few cases today that are being referred for outside treatment or specialized medical treatment. Most of them now are able to be handled in the country. So we've done a lot. So, but like I was saying, development, there's no end point. Like yes, today we have everything. There's no end in the US or in Europe. They've never reached that. So what we're saying is that we can measure our progress from where we're going to where we are and where we are going. The vision is very clear. That is why we improve the supply of medicines and medical supply. The PF government is the first government to establish the National Health Insurance Scheme, NIMA, the National Health Insurance Management Authority. That act of 2020, which established National Health Insurance, was basically, signed off by the president to address exactly the same questions and the criticisms from the opposition. Because how else do you ensure that you have enough drugs, you have enough equipment? It's by increasing the pool of funding. We have what we call the Abuja Declaration, which says countries should spend 15% of their budget on healthcare. How do you spend 15% of the budget on healthcare? You cannot sacrifice all the other sectors like education, agriculture, and other sectors. That is why the government had to think outside the box. Apart from what is coming from the budgetary allocation, let's also create a national health insurance, which is basically a scheme that collects funding, what we call risk pooling. People are contributing, and then not everyone is sick at the same time. Those who are sick at that particular time will access health services at a very subsidized level. And I think those who are beneficiaries of NIMA, who are close to 1 million now, can attest to that fact, that they're able to afford healthcare services, complex medical procedures that they couldn't afford paying out of pocket, what we call catastrophic health expenditure. In the past, for you to do a complex surgery like hip replacement, you have to sell furniture, you have to borrow as families. But today, as long as the procedure is covered under national health insurance, that's what the risk pooling, and people are able to access that. So it's a right way to go. Our aim as government is to make sure that all Zambians are subscribed to the national health insurance scheme, because that way we'll make sure that all the 18 million Zambians are catered. Those who are rich, who can afford private healthcare services elsewhere, they can still contribute to the national health insurance, because we have to help the poor. The PF is a pro-poor government. We don't want to leave anyone behind. No one should die because they are too poor to afford. So that is basically the national health insurance scheme. And the good news is that if you go to the bigger health facilities today, go to Kabwe, Central Hospital, go to UTHS itself, go to Ndola, Kitu, they are using part of the national health insurance, contributions to purchase their own drugs. They've been doing renovations of their own wards. So apart from what government is giving in the yellow book, in the budget, we are also getting a lot of other resources from the national health insurance. And as we aim towards universal health coverage for all, we expect that national health insurance will even benefit Zambians more, including the drug supply, including recruitment of health workers, including the purchase of specialized equipment. So there's no magic bullet, but we should congratulate ourselves as the PF government that we are the first government in 57 years since we got independence to have a national health scheme for the country. I don't know what other governments were waiting for 47 years, but we've done it, and we've subscribed close to 1 million people as we talk. Our aim is to make sure that all the 18 million Zambians have subscribed to the national health insurance scheme. This is the same case if you go to the US or other developed countries. In America, they have Medicare and Medicaid, which were established after the Second World War, when Americans had no access to essential services. You go to Britain, the NHS, National Health, where it also caters British and other foreigners resident in that country. They subscribe and get support, services. The same is true in many others. So Zambia, for many years, had remained behind until His Excellency President Edgar Chanda pushed for the national insurance, bill to come to Parliament, passed in Parliament. The opposition actually opposed the health insurance bill. Amazingly, they opposed it. I was almost suspended in Parliament for defending the national health insurance bill because I belong to the Parliamentary Committee on Health. And today, the opposition members, if they go to UTH, they go to these hospitals, are benefiting from the national health insurance scheme. So I don't know which person today in the modern world, in the 21st century, will be opposing health coverage. People have funeral schemes. The way you cover yourself for a funeral, you die, we bury you. You are not even there to witness your own funeral. But how do you prioritize the coverage insurance for funerals before you insure health? We don't want people to die. So actually, coverage insurance for health should have come first before the funeral schemes that exist. So the PF government cares for Zambians. That is why we have brought the health insurance scheme. And it's working very well, and it will keep on growing. So it's a huge part on our back, actually.
Great stuff, Dr. Chanda. Now, you know, the era of COVID-19 has brought a lot of devastation, especially, you know, to developing countries such as Zambia. I mean, if big economies have really been affected at a huge scale, what to talk of, you know, a small economy such as this one, but also we acknowledge that there are frontline workers who are the health workers that are trying their level best to manage the issue of COVID-19. The question therefore is, how is the government of the Republic of Zambia taking care of these frontline workers?
PF government, the frontline health workers are our heroes. They are our heroes and heroines. Without them, we would all not be here. So these men and women sacrifice. They go in those ICUs. When all of us are sleeping at home, they are managing very critically ill patients. And I should mention that in the process, a number of health workers have gotten infected and died from COVID because they are high risk. You know, you put yourself at risk as a frontline worker. You remember when we had the first wave of the COVID-19 pandemic in Zambia, you know, early last year in 2020, somewhere March, April, there was a lot of talk about PPEs, personal protective equipment for health workers. Because look, like I was telling people, no country in the world, whether they are America or European countries, China and others, no country, no healthcare system in the world was ever prepared for the COVID-19 pandemic. Because the COVID-19 pandemic came out of the blues. It started in December 2019 in Wuhan, in China. That time, even World Health Organization had not declared it a pandemic. Everyone thought it was a localized, you know, epidemic somewhere in Wuhan. No one could ever foresee the devastating effects that the COVID-19 pandemic has had. And if you look at Zambia, Zambia is just one of the countries, but I'm very, very proud as former Minister of Health. I'm very proud of the way President Edgar Chagwa has led the COVID-19 response in Zambia. Yesterday, when the president was officially commissioning the Simon Mwansaka International Airport in Ndola, at which I was present, he clearly stated that, you know, when COVID came, there was all these reflex actions, even among opposition politicians, a number of them, let the whole country go under total lockdown. Everyone was calling for a lockdown on knee-check reflex, because South Africa is doing it, another country was doing it, UK was under lockdown. The president said the wheels of the economy have to run. COVID-19 is not only a health issue, it's also a socio-economic issue. So not only is it affecting the health of Zambians and people all over the world, but it also affects businesses, economies. There are shutdowns. Look at how the global economy basically went into recession. Every country, apart from China, has had negative economic growth because of the COVID-19 pandemic. But one of the wisest decisions that the president made was to make sure that the country did not go under economic lockdown. If Zambia had gone under a total lockdown, as we talk today, the economy would be in shambles. And the same opposition leaders who are calling for a total lockdown will be on us right now as we campaign to say PF has destroyed the economy. So the president has allowed the socio-economic status to go on in the country uninterrupted by COVID. Of course, we are also an import-based economy. A lot of imports will not come, but there's also a silver lining to every dark cloud. What COVID-19 has done is that although it has devastated socio-economic status of various lives, companies, nations, but it has also given rise to a lot of ingenuity, a lot of initiative, countries looking inwards. What can we do without relying on imports? That is where the opportunity is. So for us as PF government, we're very proud of the way His Excellency the President has led the COVID-19 response, especially in terms of where the running of the economy is. Today, we can even talk about a kwacha, the local currency, which is gaining strength against the dollar, when many currencies in the world are going backwards, because the people have confidence in the kwacha. Of course, yes, the global copper prices are up, but I can tell you that if Zambia had gone under total lockdown, as advocated by UPND, by MMD, and all those other opposition leaders, today there will be no economy to talk about. We have seen this happen in countries that I don't want to mention, where people were put under lockdown, They became so hungry. They started rioting, looting. A country goes to waste just with lockdowns, and they are unenforceable, most of them. I know of countries that I don't want to mention, where when they went under lockdown, there were more people who died with bullets than with COVID. You know, because they had to enforce very strict lockdowns, where armies were on the streets shooting anyone who is not wearing a mask or not staying at home. But Zambia, if you look at our statistics, we have lost people, yes. But if you look at the mortality rate due to COVID in Zambia, you look at the recovery rate for COVID patients in Zambia, it's way, way over 96, 97% in terms of recovery. Mortality is just still about 1%, 1.7%, much higher than the regional average, much higher than the continental average, much higher than the European average, much higher than the global average. So in terms of the outcomes in the COVID-19 pandemic, Zambia has actually outperformed a lot of developed countries. We have better health outcomes in the COVID-19 pandemic than countries in Europe, countries in North America, and there are many countries in Africa. We have better health outcomes than South Africa, our neighbor without borders. So that is again due to the wise decisions that the president made. So we've had to do a balance. You balance the health needs of the people, you also balance the socio-economic needs of the people. And I think we have achieved both. We have just witnessed a very devastating third wave. We are coming out of it. I think what is key is for Zambians to just obey what the health workers tell us. Just obey the 5 golden rules. Apart from the 5 golden rules, which we already know, wear a face mask, avoid crowded places, physical distance, stay at home when you can, hand hygiene, wash your hands with soap and water or use hand sanitizer. The basics that we can do. In addition, I'm very proud as former Minister of Health that the President, leading cabinet itself, authorized the national COVID-19 vaccination program for Zambia. April, if I remember, it was April 14th, when cabinet had that special meeting to approve the national COVID-19 vaccination program. That is why, as we talk today, we are talking about AstraZeneca vaccine that has already come into Zambia. We're talking about the Johnson & Johnson vaccine that has already come into Zambia. We are talking about the Sinopharm, where a lot of Chinese residents are about to be vaccinated. It's a basket of vaccines that cabinet approved. Again, that is because the president led it. There were countries that I don't want to mention who were deniers. They denied COVID vaccines, and we have seen the devastating outcomes in some of those countries. But here, the PF government, led by His Excellency the President, has charted the way. And I'm very happy personally to see a lot of vaccine skepticism, vaccine denial going down. Because when we initially brought the vaccines to Zambia, when we launched the national vaccination program at UTH, you remember the skepticism that we had in Zambia, you know, the social media propaganda, conspiracy theories, the 666. I remember when I got vaccinated, people were saying, let's give him 2 weeks, he'll become a cat. Yeah, but here I am, 6 months later, I'm still a human being. And I'm happy to see queues, people standing for vaccines now as we go on. So, again, that's the president. And yesterday, the president, when he was opening the airport, the Simon Mwanskapot airport, he was encouraging Zambians to get vaccinated. Because no one knows when the COVID-19 pandemic will end. We don't want to lose lives unnecessarily. When government has brought the COVID-19 vaccination, let's take it. And the good news is that the more citizens we get where we vaccinate, the better the health outcomes. Life will go on as normal, uninterrupted. You can go anywhere that you want, you are vaccinated, you are not a danger to yourself and to the other people. So basically the way out of the COVID-19 pandemic is vaccination, and the government has provided that. You see with politicians like the opposition, now they cannot talk about the COVID-19 vaccine program in Zambia. I'm sure you haven't heard any opposition leader, whether in UPND, MMD, TP, and whatever. Because I think they are also vaccinated. That is my case. Because their own members were calling me as Minister of Health. Because initially they said, we cannot trust the PF government to bring in a vaccine. When we brought in the vaccines, some of them, I don't want to mention them, were calling me, Dr. Chanda, where can you get our vaccines? That is why we established that vaccination center at Parliament, where parliamentarians and opposition members were all getting vaccinated. And I'm very happy that we have not politicized the COVID-19 vaccination program. So we are very proud of that achievement. And the economy is running, the wheels of the economy are running, and here we are, the schools are reopening and all that, but we want to vaccinate. The 8.4 million Zambians that we have targeted to vaccinate, we're still a long way to go, but we're on the right track, because the vaccines are here. That's what I would say.
Great stuff, Dr. Chanda. Now, I think that health security of a nation is of fundamental importance, especially, in, avoiding shocks such as the COVID-19 and other pandemics that, might come after such things such as the COVID-19. How prepared is Zambia for this kind of thing in the event that we have other, pandemics? How prepared are we, so that we don't get shocks as a nation?
Yeah, the greatest challenge that you and I have had to face in our lifetimes, since our years that we've lived on this planet, is obviously COVID-19. There is no pandemic that has paralyzed the world the way COVID has done. We have had other pandemics, whether you talk about HIV, but it didn't have to paralyze the economy, But if you look at the COVID-19 pandemic, that is the greatest challenge that we've had. But the PF government is forward-looking. We did not have to wait for the COVID-19 pandemic to prioritize health security. If you look at the National Public Health Institute Act number 9 of 2020, it was done way before COVID came to Zambia, because we knew that we needed to protect the health security of Zambians. Zambia is surrounded by 9 countries. We're a landlocked country, a landlocked country. So it means that as people come into the country, they can also import in various diseases, not only COVID. There is Ebola. People can bring in Ebola. They can bring in other contagious diseases into the country. And that is why government passed the National Public Health Institute Act number 9 of 2020, which established the Zambia National Public Health Institute, the ZNHPI, which we have. ZNHPI is the health security arm of the Ministry of Health, and you can find the offices in Kapulonga. And they have tremendous work. Professor Mkonka and his team at ZNHPI, they are the ones actually, as we talk, when you go there in real time, they are tracking all these, what we call disease surveillance. They are monitoring all the major disease surveillance diseases in the world. They are doing a surveillance, working, of course, in collaboration with the World Health Organization, the other neighboring ministries of health. There are screens there. They can even pinpoint to you, like, at this particular point, we have a suspected Ebola case in this country, whether it's Tanzania or Congo, and then we need to take these measures. So they are the ones who are actually advising the Ministry of Health and Government on what measures to take on our entry points, whether they are the airports or the land borders. And that is why we've had all those measures that you see being taken, like doing COVID tests, the PCR tests at the borders, and all that. It's under the advice of the Zambia National Public Health Institute. That is the health security arm of the Ministry of Health. So we are very, very prepared, for any health security risk. COVID has tested our resilience as a country, as a health sector, and I think we've done quite well. So initially, you remember when COVID, the first cases came to Zambia, to be like, oh, an Emirates plane landed at Lusaka. There were 2 people who have COVID, or there was a couple which went to France, because those were the 8 days. But as we talk right now, we don't have to go through that panic. Because right at Lusaka International Airport, or Ndola, or whichever airport, if you don't have a COVID PCR test, which is like 48 hours old, you'll not be allowed entry into the country. We'll detain you, we test you, we quarantine you. If we are positive, the good news actually is that even among those who are testing positive for COVID, both local and those who may want to come in, we're also doing, ZNHP and Ministry of Health have been doing what we call genomic sequencing. We are now able to tell what kind of variant of the COVID you are dealing with, whether it's a Delta variant, whether it's a South African variant. We have that capacity as a country. Of course, I must give a lot of credit as well to the donor community, our bilateral partners who have supported us. Other countries, the European countries, the US government, we have had the UN agencies supporting us. Now we have genomic sequencing. So we can actually isolate different strains of COVID in the country, and we can advise which variant that we are dealing with, whether it's a Delta variant, these South African variants, and all others. So in short, I think as a country, we are very well prepared. I should also mention that the Zambia National Public Health Institute, which is established by the National Public Health Institute Act number 9 of 2020, also comes with a fund. There's actually a National Public Health Institute fund that is established under that act, that is still being operationalized. The whole idea, again, is not just to rely on the central government, the Ministry of Finance for every emergency, because no one budgets for a pandemic. When we were making the budget for 2021, we did not know so much about the COVID. It all just came on us. So that is why the Zambia National Public Health Institute will have a fund established under it. This is in addition to that I talked about, the National Health Insurance Fund, We have under NEMA, that scheme, the fund, that we may also employ in terms of when you have a pandemic, an emergency, a crisis. So in terms of preparedness, disease preparedness, we're very, very prepared. We're able to do disease in collaboration with the WHO or neighboring countries, and we're able to advise Zambians and the nation on what to take. And actually, Cabinet relies on ZNHPN and Minister of Health. We advised on what measures to take as a country as we face the various disease emergencies that we have.
Yes, Staff Dr. Chanda, time has flown by, you know, and as a party functionary of the Patriotic Front, I just want you to, you know, take a few seconds and speak to the people of Zambia right now and perhaps explain, because you are making a case for the re-election of the Patriotic Front. Why should the people of Zambia vote for President Lungu and the Patriotic Front on the 12th of August?
Yeah, so my case to the people of Zambia is not to experiment with leadership. The times that we're living in, we have two serious challenges that you don't want to experiment. What I've elaborated here in terms of the health sector reforms that the PF government has had to take, whether in terms of infrastructure, the chain, for medicines and medical supplies, the recruitment of healthcare workers, the COVID-19 response. The opposition, they have no clue, they have no idea what we're talking about, because we govern on the basis of a manifesto. In my hand right now, I have the PF manifesto. This is the 2021 to 2026, which is the social contract of the PF government with the people of Zambia. Everything that I say, what we have achieved is already here, and what we plan to do is already outlined here. This is the social contract. The opposition have nothing to offer. That is why they're not campaigning on the basis of the manifesto. What does it say on how they handle the COVID-19 pandemic, on the COVID-19 vaccination, on all these huge challenges? So President Edgar Chagwa and the PF government has scored much bigger, much higher than the two previous governments who governed for 47 years. We've achieved most of what we've talked about in just under 10 years, 9 years, huge achievements that we've done in the health sector. So I would urge Zambians, especially benefited from the rural health posts, from the district hospitals that we've talked about, the primary health facilities, the mini hospitals, the specialist hospitals, the teaching hospitals. You can see it for yourselves. It's very tangible. It's not something theoretical. If we want those things to continue, let us vote for President Edgar Chagwa and his government. In my language, we say Sungo Mukoshi, Bulunguta Bwafi. Always keep your neck, because the necklace will come. No one cuts off the neck because you have no necklace. Because in order of priority, the neck is more important. The neck is what I've outlined here. We've done the necklace are the fine things of how we want to make sure that the National Health Insurance Scheme operates to its full capacity. The Zambia National Public Health its full capacity. The Zambia and Medical Supplies Agents, which is supplying drugs and other medical supplies, operates capacity. And I mean, so to me, the case is very, very clear. Sector, no one is offering an alternative. I challenge UPND, I challenge MMD, I challenge DP to offer an alternative in the health sector. They have none. That is why they choose to, instead of talking about substantive issues, because they have nothing to offer, and they're also beneficiaries of what I've outlined. So Zambians, please vote for President Edgar Chagwa for us to see continuity in the health sector. Remember, a health nation is a wealth nation. For us to be healthy, to be wealthy, we have to be productive. And there's no magic bullet about it, apart from providing the health services that we are doing as the PF government.
Great stuff, absolutely great stuff, Dr. Chanda. And I have to tell you, we dragged you from the campaigns. We are extremely grateful that you took the 1 hour, from your very busy campaign schedule to just come and outline the reasons why the Zambian people must re-elect President Lungu and the Patriotic Front back into office on the 12th of August. And we know that you are going back into the campaigns, and we wish you well as well, because you're also a candidate for Bwana Mkubwa constituency. There you have it, our roundtable viewers from across the globe. This episode featured the immediate past Minister of Health of the Republic of Zambia, and this is none other than Dr. Jonas Chanda, also the PF candidate for Bwana Mukubwa constituency. Until tomorrow, when we bring to you yet another guest. My name is Nakiwe Simpungwe on the Zambia Decides, episode, and good evening.
Hey. Uyo alebwele la posori.
Uyo nilesa wasalire sori. Tapane vodunga chikabwe woso.
Chambo cha Noa, waba muwato wa Noa. Nokubamba na tubomba sofa, tatwakaleke sori. Muchambo cha Noa, waba muwato wa Noa. Nokubamba na tubomba sofa, tatwakaleke sori.